learn why a trip to the dentist should have been one of the first things on your school list of what to do. If it wasn't, we're going to help you out in that area too.
All right, plus prepare your child for his first trip to the dentist, and it doesn't have to be as scary as you think. My teeth okay?
Your teeth are gorgeous, darling. He's gorgeous. Gorgeous, darling.
Flattery.
This is NBC-6 South Florida Today.
Well, in the weeks before the kids went back to school, many of you parents were probably running around from the pediatrician to the sports physicals to the eye exams, the hearing tests. But did you remember to make a trip to the dentist? Dr. David Vine is joining me right now. Dr. Vine, thank you for being here.
Thank you.
Okay, so this might sound obvious, some of these questions, but it's worth reminding people. First of all, at what age do you take your kids to the dentist the first time?
I met with a pediatric dentist this week and an orthodontist, and I asked them that question. I'm a general dentist.
Right.
The pediatric dentist says their rules have changed. They want the child to be there by age 1.
Really?
Which seemed young to me, but the idea was not to treat the patient at that time, but to get the little child used to going to the office and to educate the parents in terms of proper hygiene, so later on they won't get a lot of decay.
Well, because, I mean, what's happening in a kid's mouth at 1? I mean, all the teeth haven't come in yet, definitely, right?
No,
yeah.
It's just more of an educational thing. Just
to get them comfortable.
Yes, exactly.
Okay. Why is oral hygiene so important? I mean, a lot of people would say, hey, you know, either way, you're going to have dentures at some point in your life. But that's not necessarily true.
No, it isn't. The baby teeth are very important because they maintain the space for the jaw to grow and for the permanent teeth to erupt. So if you lose a baby teeth prematurely, you need to replace it with what's called the space maintainer. So you have that space. And the hygiene is very important for that reason. It's important that they brush properly and take care of their teeth.
So let's talk about hygiene. Brushing properly, flossing. What are the things you must do starting at an early age?
Well, there's a terrible situation called baby bottle syndrome, which basically means the mother puts the child to bed with a bottle in his mouth. And whether it's breastfeeding or that, it causes rampant decay. So you want to avoid that. And if you are breastfeeding, and let's say the baby's crying at night, and the only way you stop the crying is more breastfeeding, you want to take gauze and a special toothpaste that the child can actually swallow and it won't hurt them, and clean the teeth. That's very important. So
before or after their breastfeeding?
After, yes.
Right after.
Yeah,
okay.
and after eating sugars and things like that. If you can, the cleaner it is, the less bacteria on the teeth, the less decay.
So how long do you brush your teeth for? What's some good advice?
As long as some people use a little timer thing, you know, but as long as you can reach every tooth surface.
Right.
You know, if you can do it quicker, that's fine. But you want to hit every tooth surface. So there's no absolute timing, you know. So
tell me about the routine. Once the kids get to school, they have their teeth, they have all their baby teeth in. What's the routine they should do every single day? 3 times a day you're brushing, after every meal?
Twice a day at least. Certainly before you go to bed, that's the most important time.
Right.
And then in regard to orthodontics and jaw growth, the orthodontist is saying that they should come to the orthodontist at age 7 just for an evaluation. Because a lot of times they can detect things that will cause problems later on, and they can correct them.
Right. When a child comes to your office for the first time, what do you do for the visit?
Well, again, I'm not a pediatric dentist.
Not your office, I'm sorry.
Okay,
but to a pediatric dentist, they've come already for the first time just to get comfortable. Right. Now they come back for their first actual treatment. So what's going to happen in the office?
They're going to do a complete examination and make sure there isn't any decay. And if there is a possibility that there may be decay, sometimes there are grooves in the teeth, they'll put sealers or cavity varnish into these grooves to prevent decay. And then they should have cleanings about twice a year and fluoride treatments.
So cleanings twice a year, so that means you go to the dentist at least twice a year?
Yes.
Okay, perfect. Dr. Vine, thank you very much. Dr. Vine's office, by the way, located at 400 Arthur Godfrey Road. That is in Miami Beach. And for more information, here's the number to call. You can talk right to him, 305-538-1115. Okay. My teeth okay? All right?
Beautiful.
Yeah, I never had braces or anything like that, but someone told me I had $1 million.